One of the big things after weight loss surgery is they've lost the weight and they've diet and exercised and they feel fit. The scale says they've lost 50 kilos. They're getting good scores at the gym. They're, bike ergs, everything's going good, but they don't see that in the mirror. So that's what body contour really helps with. They get to see what they feel. My name is Pouria Moradi. I'm a specialist plastic surgeon based in Sydney. My rooms are in Surrey Hills, but the hospitals I work at predominantly here are East Sydney Private, and I work at Prince of Wales Royal Hospital for Women and Sydney Children's Hospital as my public hospital appointment. Dramatic weight loss surgery is relative, right? So if you're a 70 kilo patient and you lose 15 kilos, as a percentage, that's dramatic for you. But if you're 150 kilos and you lose 10 kilos, it's not so dramatic. So we don't try to say, oh, how much weight have you lost? I know patients always focus on that. It's more of a body percentage weight loss. So if you're 150 kilos and you lose 50, that's dramatic. So there's no right number, but it's more what happens afterwards, all the loose skin. So you can lose all the weight you lose, but if your skin retracts and you don't have any loose skin, whilst it's dramatic, you don't need dramatic surgery to correct it. One of the big things after weight loss surgery is they've lost the weight and they've diet and exercised and they feel fit, okay? So they feel like they're getting strong, they do their muscle body mass index and they do their DEXA scanning and they've got the muscle mass, but when they look in the mirror, they don't see the person that they think they are. The scale says they've lost 50 kilos, they're getting good scores at the gym, their bike ergs, everything's going good, but they don't see that in the mirror. So one of the things after body contouring, once you remove all that loose skin, then they see what they feel. So if a patient's had any weight loss, whether it's through bariatric surgery, diet and exercise post-pregnancy, what we want is for the patient to be at their stable and goal weight, whatever that might be for that patient, and they need to be stable for about 3 to 6 months. The reason they need to be stable is we don't want to hit a moving target. So if they're 100 kilos and you operate and they lose 20 kilos, then all the good work that you've done, or rather they've done, you've lost that because then they lose an extra 20 kilos. So you want the patient to be a stable weight. Hopefully they've lost all their weight and the skin's retracted and they don't need anything, okay? But if they do need something, what happens is if we look from the top down, depending on their age, they can, once they lose the volume in their face, they can get loose skin. So they may be a candidate for a facelift. If you work your way down with the breasts, you can either lose weight and lose volume. So most likely they'll need a breast reduction and a breast lift. Sometimes if they've lost a lot of their volume, they might need a breast implant or fat grafting. Then if you work outwards, the most common one after that is your arms, because the patients have lost all the volume in their arms and they've got loose skin, and that's what's called a brachioplasty or an arm lift. As we work our way down, then there's the tummy. So the tummy is the number one thing patients come in with, and your candidate might just be for a simple tummy tuck, and there's different variants of the tummy tuck. You have an extended tummy tuck, you've got a 360 tummy tuck, you've got what's called a fleur-de-lis tummy tuck, you've got what's called a corset tummy tuck, and as we work our way down, they can also get loose skin around their back in the bra strap area, so they can have bra strap resection, and then moving down forwards, the next is pretty much a thigh lift because they've got all the loose skin in their inner thighs. A lot of female patients also need a mons lift as well, because once they've lost all that weight, the mons does hang or toes over, and that needs to be lifted, secured, and liposucked as well. So I guess it just comes down to what bothers the patient. When we do surgery, we don't do all of them in one go. It's not safe. What I say to patients is define what you mean by recovery, okay? Some people define recovery when can they shower, when are they going to leave hospital. So depending on the operation they do, a breast reduction's day surgery, tummy tuck, different variants between 3 to 5 days in hospital, thighs usually about 24 to 48 hours. Now recovery in terms of walking and being normal again, you say 4 to 6 weeks. Recovery going back to work, depending what they do for work. So a lot of patients these days, as post-pandemic, work from home. So they're on a computer anyway, so after 1 week, most get back into work because they don't physically have to go into work. So it is varied on how you define recovery. But if a patient said to me, I'm getting a tummy tuck after body weight loss surgery, when am I back to normal, as in I can go exercise and whatever, it's 4 to 6 weeks.